Do you remember your first day as a medical registrar on call?
Vividly. The thing that terrified me the most was I was already really nervous about it. And you think, the medical registrar, they know everything. There's nothing they don't know, and now I'm that person. What on earth am I going to do? And my consultant supervisor came to find me in A&E to wish me luck for the day. And that was it. I was like, right, this is going to be a disaster. I'm absolutely terrified. And in fact, it was brilliant and it went really well. But it was, the morning was the most terrifying experience ever.
But the important thing is, it would be boring if you go. I don't think everybody I know that goes to a new job feels, what do I do for the first few days? And it's exactly the same when you first start as a medical registrar.
No, it's true.
That's the excitement. That's why you become a medical registrar
exactly.
in some ways.
But don't you think the other nice thing is the camaraderie among registrars? So you can ring up the cardiologist or the gastroenterologist, knowing it's someone a bit like yourself, and say, I'm just seeing this lady, or the SHO's just seen this woman, not quite sure what to do, what do you think? And that, I felt, was much stronger, partly because I guess we're there for longer than when you're an SHO.
The workload side takes a bit of getting used to. And that's about planning and things, and my junior at the moment explains that it's a little bit like she's explaining to the houseman, it's a little bit like learning to be a waiter or a waitress. You do have to juggle lots of different tasks at once, so you're a bit of everything to everyone, knowing about what's going on over there whilst you're knowing what's going over here, and also putting an order into the kitchen and everything else. But in medical terms, it's just about utilising the skills and you get trained for. And to me, it's using the skills you get trained for. Communication skills are really important. And I mean, I think that isn't just with patients. I think we don't concentrate perhaps enough with how do you generate your team that you're with to do the things you want them to do. Where do you place yourself within the team? Are you that reg that says, look, I'm going to tell you everything to do, and everything you do I want to know about? Or are you the one that can let go a bit and actually trust someone to get on with stuff and have that watchful review?
So good team skills. I think you've got to. I think being a med reg is massively being a team player, isn't it? And it's not always high drama, but you've got to kind of like that, because there are some edge of your seat moments.
Yeah, there are.
I guess that's something we haven't talked about very much, is how nice it is to be an educator and to watch a team that you've worked with over a 3-month period or whatever grow and gain confidence and more skills.
And often we see people beneath us more than the seniors see them doing
I think that's
stuff
right.
like that.
Do you have a couple of key moments that have been your best?
Strangely, it's quite macabre, isn't it? They're probably the worst moments that you've been through, and that's the medical psyche maybe. I can really remember a really unwell patient that, worked really hard with or done something, and I can remember those ones perhaps more than the positive ones.
Yeah, and it's really nice as the med reg to be able to spend time with patients and often with their families in an hour of distress. And I think probably that was one of the things I liked the most going from SHO to registrar, is you could see that it was really important to talk to ex-family about whatever really difficult circumstance was about to happen. And you could build a relationship differently from your consultant or your SHO, actually.
It is the experience, it is the organisation, it's having that sense of humour and perhaps being able to put it all in perspective.
Yeah, absolutely. And I think shepherd everybody, kind of keep everybody on board. Because it's your job, isn't it, to make sure that the day runs relatively smoothly, that people get seen in order of priority, that the team that you work for have had a good day, and if they've had a difficult time, that they've been able to talk about it and deal with it, and that they've learnt something.
I've enjoyed every single minute of what I wouldn't say that's fair.
That can't be
I've
true.
enjoyed, if I look back, I've enjoyed every single minute. During the time, there's been some times where I've been really hated being in the job, but I don't think specifically being in the medical registrar job. I've hated the job, like everyone hates their job at some time, but I've never gone, I really wish I wasn't a medical registrar. I've thought, I really wish I wasn't a medical registrar right now at the time, but I've never said I really want to change profession for a sustained time. Never really thought this isn't what's fair. I've always seen it as that's just a bit of a bad day that day. And there's many more good days than bad days, by far.
Yeah.
What do you think?
No, I think that's true. I was going to argue with you actually, but I think that's true. I've had definitely some bad days, but the good days definitely outweigh them. And even the bad days are often the most testing and challenging. And as you say, looking back on them, you think, gosh, you know, what I learnt there, I've used so many times since and has been really helpful. So actually, even in that sense, it's positive.